Kia ora, good evening. It had been a real concern for the Canterbury District Health Board. An ageing workforce meant more health professionals were needed and fast, but thankfully things are beginning to look up. There's been a lot of changes in the sector over the last few years, including the increasing number of staff through the region's health board. Earlier this month, Health Minister Jonathan Coleman released figures showing a dramatic increase in staff, both doctors and nurses working for the CDHB. And the nursing manager for the Canterbury District Health Board says it's due to some dramatic changes.
We knew that if we continue delivering healthcare the way we are currently delivering it, we would need another major hospital the size of Christchurch Hospital. So we knew we couldn't continue to do that. It was not the best use of our resources, and so we began planning quite distinctly what we can do.
Currently, there are around 930 doctors and close to 3,000 nurses. That's nearly triple the amount of employees since 2008. Before the earthquakes, the Health Board identified an ageing staffing crisis throughout both primary and secondary healthcare facilities.
Over the age of 45 plus, we have 60% of our workforce, so that's quite a scary figure when you think about long-term planning. So we've been consciously having major discussions with our workforce around that.
She says very few of the new staff coming in are arriving from overseas, with the focus being right here in Canterbury, increasing the number of graduates entering into healthcare.
We've been working very hard around looking at our workforce needs. As early as 2003, for instance, we had a new graduate program, and it was part of a pilot of 3 national programs that took place, which ended up leading a nationwide NetP program.
The Health Board had to adopt a new plan immediately after the earthquakes, something that was being prepared for a long-term arrival of 2020. And she says it's becoming easier to get new staff coming through.
And that's actually now being driven by the workforce itself. So they're coming to me now with graduates and saying, can we take one? Which has really changed around. Before, when I first started in the role, it was a little bit more difficult to get grads in place there. They were really looking for senior staff, but now they're making a conscious effort and driving the need themselves.
The first building of the new health precinct is currently underway, with plans finalised and construction due to start later on this year, with more expected in the future. The precinct will take up 4 blocks in the central city between St Asaph and Montreal Streets, Hackley Avenue and Oxford Terrace. And Hickmont says it'll have great benefits for the Canterbury region.
We've got together and been able to think about what we want for the future of Christchurch. And so what it is putting health, research, education, simulation all into one area or in one plan in place. And hopefully we will drive research excellence, so it'll become a very attractive place in the future for people to come and live and work and learn. Because we had done all this fantastic planning, some of the things that were planned in 2020 actually were put in place in 2011, and we just rolled those out immediately and made those changes, and that's consequently where you can see quite a significant growth in our workforce as well.
But this is just the start in a long line of work for the CDHB, but she's confident with the future plans.
We've got still a significant amount of work more to go into the integration side of things and to build our population of nurses. We're shifting a lot of resources out into the community and primary areas. So I think that the one area for us that we want to really concentrate our efforts now on is how can we even further build up the numbers within the community areas and begin to really shift those resources to those areas where healthcare is now being delivered.
The growth continues in Canterbury with a bright future ahead for the local health sector. Jared McCulloch, CTV News.